The following program has been pre-recorded.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe that we're celebrating our 10th anniversary of the Health Matters radio program. We are planning some special shows to celebrate the milestone, so we hope you'll stay tuned. So let's begin today by thanking our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, compounding pharmacist, and our special guest, Leslie Corns, licensed social worker and licensed professional clinical counselor, and Sarah Garbrandt, licensed professional counselor and licensed independent clinical dependency counselor, both with Chrysalis Counseling Center. Good morning and welcome to the show, ladies.
Thank you. Good morning.
Is social media making kids unhappy? Evidence continues to grow and suggests that there's a link between social media and depression. Several recent studies show that users who spend the most time on Instagram, Facebook, and other platforms were shown to have substantially higher rates of reported depression than those who spend the least time. This relationship supports the need to take a serious look at how social media can negatively affect mental health. In post-pandemic period, counseling is more important than ever. The counselors at Chrysalis Counseling Center are seeing a dramatic increase in anxiety and depression, and the population that seems to be the most impacted are children and young adults. This morning, we will talk with Leslie Corns and Sarah Garbrandt about anxiety, depression, and the potential link to social media. We'd like to remind our listeners that today's program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Leslie, welcome to the show, and thank you for your service to our community, especially during this pandemic. Tell us a little bit about yourself, your background, and your training.
Thank you for having me and for allowing me to share this information to the listener. I have been a practicing clinician since 2006 after completing the Community Counseling Master's Program through the University of Akron. Aside from a brief school counseling position in Akron, my practice has been in the Tuscarawas County.
So how about you, Sarah? Welcome to the show. Thank you for your service to our community, especially during this pandemic again. Tell us a little about yourself.
Hi, thank you. I am 27. I graduated from Tiffin University in 2016 and then Malone in 2019. I have worked in various environments at our local domestic violence shelter, then a case manager for New Philly Drug Court, and then a counselor for the Common Pleas Drug Court, and now at Chrysalis for mental health and substance abuse treatment. Currently, I treat clients ages 10 and up, and I love helping our community on a daily basis. Thanks.
So, okay, let's get right with the topic. Why do you think that anxiety and depression are on the rise, and especially with our young people?
Well, when the pandemic changed our routines, it changed the routines of everybody. Sometimes we forget that children also have issues with change, and it really is hard for them to adapt. Adults have more coping skills to manage changes in their patterns and routines. Sometimes children and teens don't have those skills developed yet. So the younger population had to change how they function completely from how they approach school to how they approach their friendships. And they became just as isolated as some of us did. This routine included technology for education. And then also, like I said, social interaction. Imagine being told that too much technology is a bad thing for you, but then also being told you can't see your friends because there's a fear that you could become incredibly sick. That produces some severe anxiety, which could then lead to depression.
When it comes to screen time and social media time, how much is too much? And as a parent, does it matter if game time and social media time equally important or equally, problematic?
So there is varied research on this. But Leslie actually got to take her kid to the pediatrician this past week, and she messaged me last night and said that her pediatrician recommended 2 hours. That's about the limit that a kid should have on technology. And when it comes to deciding between game time or social media time, it's really up to the parent because nowadays a lot of those are interlinked. Many games include chat rooms or different social aspects that it doesn't matter whether they're on a game or social media, they're getting both interactions from them. So it's just the parents being more aware.
Is it even possible to limit social media time that much with our kids?
It can happen, but it's difficult and at times might not be effective. Those parents out there know kids are tricky. They can get away with stuff. They find ways around almost anything. So basically helping your kids understand why social media can impact them and what limiting it does really is the goal here. Offering limits and boundaries and maintaining those limits and boundaries is the crucial point. And, me and Leslie talked that sometimes it's offering your kids something fun to do instead. A lot of times we just say you shouldn't spend so much time on your phone or computer, but we don't offer them anything to do. So it comes down to that, having your boundaries and offering alternatives.
How does being on social media promote anxiety or depression?
So this question's fun. Think back to a text message when you might have been younger and you were texting someone something you were very stressed about, anxious, and then you sent it and your heart just drops waiting for that response. And then potentially that other person takes 10, 15 minutes. And that whole time you're imagining how many bad ways that response could come in. That's kind of what life is like now for social media, gaming, technology in general. At all times, kids, teens, and adults still get that sense of anxiety and depression throughout social media. And then typically there's two types of people. First, there's the people that have that strong backbone and they'll post whatever they want online about whoever they want. And then that can cause depression when there's bullying, making fun of others, and just taking for granted people's expectations. And then the other side are people that overthink the conversations, like the text message. So also there's hidden factors in social media. I don't know if you guys have heard of filters, but anyone can use a filter on almost any app now. So people compare themselves. She looks so beautiful today, and I wish my hair was like hers. Well, it might be a filter. We don't know anymore. So it's constantly just comparing each other, which isn't really a good thing to do.
Why would a person feel more isolated or alone when they're communicating online with someone?
So communicating online lacks a lot of qualities that in-person communication or even just on a phone call could have. Whenever you're communicating online, you don't get nonverbal cues. That means your facial expressions. Someone on the phone or typing, they cannot see your face. They can't hear the tone of your voice, and they don't exactly know what situation you're currently in. So whatever you speak of when you type might be mistaken by someone else, which can lead to arguments, fighting, just really hurt feelings. So there's a lack of understanding of what's trying to be communicated. Also, not knowing, like I said, what's going on around somebody. Kind of like that text message, if it takes 15, 20 minutes to reply back, maybe you don't know what's going on at that other person's location. So when you communicate in person online, you get all those cues that you can understand the conversation better.
All right. Well, how else might social media impact a person?
Social media can impact people in many different ways, but one of the major struggles that we notice is called the comparison trap. When there's countless ways to compare, like I said, with the filters, it can give people countless ways to create a persona or a picture of themselves that they're flawless. We get caught in trying to compare ourselves to everybody else, and there's this idea of what we should be, and it can be as a student, a mom, an employee. We get it stuck in our heads that we're not good enough because we're not doing what that person's doing. And if we don't fit into that idea, there's something wrong with us. The teens, the adults, they come in and one of the first things they say is, I'm not good enough.
So it's almost like a different level of keeping up with the Joneses. It's like the digital version. Instead of buying a new car because they bought a new car, it's like, well, why can't I go to Maui like they did? Or,
exactly.
Oh, I'm worthless. Or,
well, the other side of that, too, is, okay, let's look back in the last century when I was in school, okay? The only comparisons that you had then was she's more popular, he's more popular than I am. His clothes are better than mine, okay? He looks nicer, or he's a better athlete. So online, are these basically the same things that you guys are hearing?
It's those, but taken to a new level. So now kids come in and they say, Jane Doe is so much prettier than I am. And she posted on her Snapchat making fun of me because, my shirt was a little weird the other day. And then all the kids in the group start commenting on it, making fun of that person. And then it just leads to not only I'm better, but there's now the added aspect of you're not as good. It's gross. It's now a lot more easy for kids to be cruel to each other in many new ways.
Okay.
Exactly.
Because they're not face to face.
Yes. They get the backbone and they get that courage of I'm not going to see that person's reaction, so I can post it.
So would you say that's the cruelty coming out of this person that is being harbored inside of them?
It could be. It's more like just they like to pick on each other at times. Mm-hmm. And the words aren't, you look ugly today. They use new words that, our generation would be baffled by, but they think it's normal.
Okay, so too much time online obviously can lead to a person feeling socially isolated and lots of peer pressure, lots more, I guess, than face-to-face. I mean, I can put myself back in high school and think, some of these kids were really rough, but for the most part, it wasn't really like it is today with the computers and the Facebook and the, whatever site you're on.
Exactly. They have instant access to anything that they want now.
What about other problems from being online too much?
So one of the things that I did want to discuss was back to that idea of that comparison trap. Just because it's basically a form, like we said, of peer pressure. The pressure to fit in has become the focus. That is now what people want with internet and social media. So I wanted to share a real example of one of my clients that I got permission from, 14 years old. And this client convinced mom and dad to download Snapchat, a very, very common, popular app. And this app he had for 3 weeks. This young person did not use curse words. He respected people. And I mean, I've known him long enough to know those are his traits and qualities. Within those 3 weeks, he was cussing online, cussing through text messages, degrading women. And when his mom found these messages on his phone, they took a stand and made him delete the entire app. But when he came in for his next session, he cried and said, I got stuck. If I didn't talk like they talked, they made fun of me. If I said she was pretty instead of sexy or hot, they made fun of me and I didn't know what to do. And I just was baffled that that was a real life example almost of how quickly social media can impact somebody. I think it's just different generations have different concerns, and this generation's all about fitting in. That's what their primary concern is. And I mean, even when we were children, having friends was a big deal to us, but we didn't have the ability to just message our friend instantly and have a response in 2 seconds. If we wanted to hang out, my mom would call their mom and say, hey, Sarah wants to have a hangout or a sleepover. What's, Kate doing? And we would set up a date. Now they can just text each other and say, want to come over tonight? And it's just so instant. Another problem, though, with being online is also people's health. I want to actually really focus on that, too. Fan of Isaac Newton over here. A body in motion stays in motion. A body at rest stays at rest. I have so many clients of any age that come in, and I'll ask them to check their phone to see how much time they've had on social media.
Oh, yeah.
Sometimes it'll say 7+ hours. And that's
a day.
So I'm thinking in my head, how much time did you spend sitting on your tushy, not doing anything? And that just puts you into a cycle, because we have found that, physical health is directly linked to mental health too. So when you sit all day doing nothing, it can exacerbate your mental health, your depression, your anxiety, and then you're in that vicious cycle of continuing to not take care of yourself. And that's why, me and Leslie both will talk to our clients about, not only do you have to care about your mind, you got to care about your body. They're all connected. So that's just another major issue with being online too much.
Motivation to get their children out of the house and doing something physical has become quite challenging. And so typically that's a treatment goal that they're wanting to incorporate. We're going to ask was if most people do spend more than that 2 hours a day, and had touched on that she has had clients spend up to 7 hours a day. Well, when we went to the pediatrician with my 12-year-old son, and the pediatrician said, no more than 2 hours a day on your device, Carter and I had that conversation, and I said, well, how much time do you think you're on your phone? And he says, probably 5. And I said, probably 5. And honestly, I think most people do spend more than 2 hours a day, and myself included. I believe we're all guilty of overuse. And I'll give you an example of how easy it is to fall into that. If I go online to look for restaurants in the area, I might find a restaurant and it links me to Facebook to look at what their menu is. Pretty soon I access Facebook and I might see a post I like, and then the next thing I know, 40 minutes, I'm browsing photos. It's just that simple to get lost in that trap.
Amazing.
Yeah.
Should we take a break here, JD?
You're listening to Health Matters with the Medicine Center Pharmacy.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Hundreds of new items have arrived at the Half Off and Out Buy store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. And lots of new toys, Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook. We continue our 4th of July super sale of 20 to 50% off most merchandise. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
The following program has been pre-recorded.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Joining me is Brad White, compounding pharmacist, and our special guest, Leslie Corns, licensed social worker and licensed professional clinical counselor, and Sarah Garbrandt, licensed professional counselor and licensed independent clinical dependency counselor, both with Chrysalis Counseling Center.
So how do we break the habit of too much social media time? What are your tips from the experts here?
So I would guess that most individuals listening are unaware of how social media can negatively impact their lives and most significantly their children's. So breaking the habit starts with recognizing the impact physically, emotionally, and specifically in relationship to others.
I'm going to play devil's advocate for a moment real quick and say, well, my kid spends a lot of time on social media, but he or she's watching educational videos or or they're learning things. How do you divide learning time versus social time?
So I do think that structuring time is important in terms of building consistency in a child's life and creating balance. And anytime I have a client or a family coming in and saying there's a mental health issue, whether it's anxiety or depression, you can argue, yes, they're watching educational information online, but it still needs to be in balance to what they're doing physically, or if they're doing something socially face-to-face with someone. So it just really is all about moderation and balance at that point. And so structuring that time within other activities.
So let's talk a little bit then about relationships with others. How do you see relationships with other people being impacted by social media, either in a positive or negative way?
So a common discussion that I hear in session between couples and families is that their partner or children aren't present. And so, for example, everyone may be in the same room together. However, there's a preoccupation with relationships online or viewing social media information, and that the relationships right in front of them are suffering. And there becomes an obvious disconnect of family members. And it's almost as if the priority is what's here versus I'm sitting right here. And that's where things start to fall apart.
You go into a restaurant and you see people between entrees or I don't know, whatever, everybody gets their phone out, and they're all on their phone. And I'm thinking, even the little kids, everybody gets their phone out. And I'm thinking, okay, you guys are going out for dinner to have a good meal, okay, and to have a little social conversation. But it doesn't go there. I mean, it goes to the phone.
Right.
What do? Take their phones before they sit down?
So, that is a rule that some families have adopted. It really just depends in terms of breaking habits in families where the preoccupation of the device and being online or with social media is the problem. What rules you want to establish. And so for some families, it's put your phones away at the dinner table. And that includes going out to eat. Now, I have to say that for me, going out to eat with my family, that is more my preference than my children. That is a treat I enjoy with my adult friends. And so if I want to enjoy that, I may allow a device. But that's the expectation in my family. That may not be the expectation in another family.
We went out for dinner last night, okay? It was our 53rd wedding anniversary, okay? My wife and myself. And we were in a local, very fine restaurant. And you looked around and all of a sudden everybody was on their phone. And I picked up my phone and she picked up her phone for a couple minutes, between food being brought and taken away. It's just like it's a habit. It's a habit we got to break. And I don't know how to break this habit,
So there are some steps to do it within your family or within your friend groups, adults to adults. And you can set a goal for yourself. You can write that goal down on a paper, and then you can tell someone else about that goal. It can be the first step to breaking that habit.
So I think you're talking about accountability buddy type stuff. So why don't you speak to that?
Yes. So the research shows that when you write something down that you want to do, you're far more likely to do it. And writing things down helps with follow through. And when you share your goal with another person, it helps you stay more accountable in trying to accomplish that goal. And that person that you share it with can be your accountability buddy. And that person can respectfully hold you accountable for follow through with your goal. And oftentimes spouses will do this for each other. And I'm hoping that with increased discussion, like in this platform now, and awareness, that caregivers listening can work together and create support for one another to reduce the use of social media together, that we all can be holding each other accountable.
So this isn't funny, but what you don't want is you don't want your accountability buddy getting online and flaming you for not following through on your goal, right? You want it to be a face-to-face, positive, supportive experience that you work together to get to that goal.
I didn't even think about that, but you got yes, that would be quite counterproductive.
I see this as a really big problem. And what are the teachers you know, okay, all the kids in the school have a Chromebook, or they get, you know, something, all studies all summer. They've had Chromebooks or whatever, laptops or whatever. Where are we going with the schools on this thing? It's just, okay, if I'm sitting in a class and I'm a little kid, you know, okay, and I'm allowed to have my cell phone, okay, in the classroom with me, what am I doing? I'm texting the kid next to me, or the tech, up the way. I mean,
well, I can only speak to the school district that my children are enrolled in. And I will say that I think the schools are doing the best job that they can in really limiting the websites that they are allowed to go on, which I believe most social media places are blocked. They try to discourage cell phone use in the classroom, and there are specific rules about when and where cell phones can be used during the day. And there are, if they're using a school Chromebook, everything is monitored. So if there is a email or a chat discussion within the school day, or even after hours, that happens to have words that are concerning, they're flagged and they get sent to the guidance office. And so I know this firsthand just with clients coming in who have, for example, searched up poetry that seems to be depressive in nature or indicate any sort of self-harm attempts or curiosity. They'll immediately be identified as high risk and be given resources for that. So I do think the school has tried their best to make sure they're limiting those avenues on their devices and while they're in their care.
You're listening to Health Matters with the Medicine Center Pharmacy.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used. Poison ivy pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with poison ivy pills at the Medicine Center Pharmacies in Canton, Louisville, and Minerva, where wellness begins. Vote for us, a multi-winner of Best of the Best Pharmacy.
The following program has been pre-recorded.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Joining me is Brad White, compounding pharmacist, and our special guest, Leslie Corns, licensed social worker and licensed professional clinical counselor, and Sarah Garbrandt, licensed professional counselor and licensed independent clinical dependency counselor, both with Chrysalis Counseling Center. Okay, so as a counselor,
Yes.
how do you help a parent put a plan like this into play? Okay, now my grandchildren play ball. Okay, both of them play baseball. Okay, and they've had a heck of a lot of games in the last few months, so that does get them away. But I'm going to tell you what: the moment they get home, they're back on those. They're back on those things up in their bedroom.
Yeah.
So, what's the next move? Get the kid home from the baseball game and he's exhausted, and you take him back out to do something else, or
So I think that, I had spoken to this earlier in terms of increasing understanding within the adults about the negative impact of social media on our youth and on ourselves, the adults. I think that information probably is important to share with our children, so that if there needs to be some habits that are to be broken in the household, that the children understand that the changes that are being made with limiting social media or device time aren't necessarily punitive, or they haven't done anything wrong, that there's research supporting the reason for these limitations. And so here's why we're doing this. We're doing this together. And it's important that the adults in the family are also committed to the process, because without their follow through as well, the plan is not as credible and the children won't buy into it.
Okay. I'm getting that most parents just kind of let them do it. Okay. Is that pretty accurate? Okay. As opposed to looking at them sitting in a chair for 2 hours and saying, okay, come on, we're going to the zoo. Or something along that line.
I don't know that is a fair assessment. I think that if they're not aware of just how damaging the overuse can be, then there's probably they probably are permitting it just because it seems harmless, So, and a lot of times kids will say, when you take my phone away, that's my outlet. Those are my friends,
It's my life. Yeah.
Yeah. And so they have this very emotional argument, and they're really good at finding excuses to maintain that habit. And so the parents often listen. No parent wants to see their child go through pain or the anxiety of that resource being taken away from them. So I could see it being a real struggle.
Okay. Me too.
All right, so how about this? A program like this raises awareness for a lot of parents and maybe kids, hopefully too. How about outline a plan for us that maybe we can start to think about, and then maybe if we didn't realize there was a problem with someone in our family, it might help us realize there is.
Okay. So after, I would assume that caregivers and adults, provide information to their youth about things need to change. They may start to identify how much time should be allowed on devices, and start to identify where and when devices are permitted throughout the day. And so a plan may look like purposeful structuring of time together that will not include devices. This not only assists in keeping everyone accountable, but increases connection between family members. For example, no phones at the table during meal times. Maybe you can also include movie time on a weekly basis as another example, so that, during movie time, devices go to a certain hub where everyone's kind of plugging their phone in to charge. And that, but each family's plan may differ, determined by the ages and need of those family members.
Are there any other rules you could suggest for parents to try to formulate their plan? Because I can see how it would be very custom based on your family dynamic and who works when and what shift and things like that.
I think the different rules that I tend to really zone in on when I'm talking to a family would be, I do like to keep mealtime device free. And I do agree to remove cell phones from children at nighttime. So I think there should be a structured bedtime where the cell phone is put up and out of the room for the evening, and that can be returned in the morning when they wake up.
Do you have a recommendation based on an age category? Like, should a 6-year-old have a different time allotment than maybe a 16-year-old?
Yeah, I do think it can vary. I think that also because there is such an attraction to social media and being on our devices, especially as children get older, that we can use that to our advantage as parents. Meaning, if 2 hours a day is what the research denotes as being healthy, but we've got a child who is struggling with motivation to perform chores or turn in their homework, maybe we add some incentive, meaning if you are able to mow the lawn this week, then I'm going to add 30 minutes of time to your device usage. So we can use that as leverage as caregivers. And I don't think 30 minutes extra on a Friday night or spread out over the week is going to become negative within reason and not, become excessive over time.
It's in the framing, right?
Correct.
Yeah.
It's within balance and moderation.
Yeah.
I definitely think with having the web be this hub of information that can take what our history books have and then allow us to zone in on one particular person and history and get a wide variety of knowledge, that it does allow us to increase our knowledge much quicker. And that for that is this generation able to become wiser quicker? I don't know what the research says, but my guess would be sure, why not?
You're listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used. Poison ivy pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with poison ivy pills at the Medicine Center Pharmacies in Canton, Louisville, and Minerva, where wellness begins. Vote for us, a multi-winner of Best of the Best Pharmacy.
The following program has been pre-recorded.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Joining me is Brad White, compounding pharmacist, and our special guest, Leslie Corns, licensed social worker and licensed professional clinical counselor, and Sarah Garbrandt, licensed professional counselor and licensed independent clinical dependency counselor, both with Chrysalis Counseling Center. Wonderful what's on the internet. I mean, what you can find, fine, you can find the address of the restaurant, but you can look up any historical person on the internet and find out the world about him. So that sort of thing is really amazing. But are the kids using this thing?
Yeah. See how I see it, which, yes, we do have the ability to look far and wide for information online, but there's also a double-edged sword on this, because on the other hand, we're not as accountable to memorize the information. When I was in school, I had to open my textbook, take notes, really, really focus and learn this stuff for facts. Nowadays, I don't have to remember
because you can go back to it at any instant.
I can just
okay. How interesting.
And I've had kids come in here and tell me this past year with the pandemic, I didn't study for that test because I just had my phone beside me and I Googled the answers. So, you do have access to a ton of info. You're less accountable to know the info. It doesn't.
That's very interesting. I had never thought about that. You are right. Gosh, you get it in a second.
On the web is accurate information. There's a lot of misinformation out there.
Yeah, sure. And then
all right, so I'm thinking back about your ideas for parents for making a plan at mealtime or keeping cell phones out of the bedroom. But Mom, my cell phone is my alarm clock. What do we do about that?
Oh, I hear that so often, and I think it's a good argument, but I would just stick with traditional alarm clocks and really keep that device out of their room. It's just far too tempting, and it's much more practical to have a typical alarm clock.
I love it. What about, I know that there's a lot of tech out there, and do you have any app or tips for parents to recommend to monitor what their kids are looking at, or how much time they look at it, or how to filter some things out?
Yeah, actually, I think Sarah was going to check in on this for me. She had an idea, so I'm going to turn to her.
So this is the kind of thing I love doing research. So I went through and tried to search for us as many apps as I could to figure out which one looked and sounded the best. After doing some deep research, most apps that actually monitor what parents would seemingly want do cost money. Even the ones when I Googled free would then pop up later and say it's a free trial and then costs money. So the cheapest but most effective that had really good reviews and ratings was called Bark like a dog. So it's Bark. It connects to over 30 platforms, and it checks through whoever it's connected to, the children. It can go for more than one child in the house, their text messages, their emails, photos, videos, and social activity on many different platforms to track the content and conversations. So anytime, and like Leslie said with the school, it flags certain things. And it listed all kinds of stuff. It listed online predator indication, adult content, sexting, which is when children refer to sexual content between each other, cyberbullying, drug use, suicidal thoughts, mental health concerns in general. The list went on. It will send a message to the parents that states, hey, mom, dad, this was just noticed on your child's whatever account. And then you don't have to spend day after day monitoring the phones or devices to be aware of that. It builds trust, I think, because that then helps the parents not consider worrying 24/7 when they know they'll get an alert. And it works on iOS, Android, and Amazon devices. There weren't many that also worked on Amazon devices. The price of this app is $14.99 a month. I know that may come as a shock compared to some parents who are like, oh, my blah, blah, blah is only 99 cents a month. But compared to the other apps, that was cheap. And how many cups of Starbucks coffee is that? $14.99. It's not too much. Or you can get a reduced rate for $99 annually. That seemed to be the best, and it was called Bark.
Interesting.
Yeah.
All right. So to summarize, you believe that especially with young people, too much time spent on social media, it can be possibly harmful to them emotionally and physically in their relationships, and could also possibly increase their likelihood of becoming anxious or depressed.
Yes.
Do you have any parting words before we wrap up? We want you to share your contact information for parents who've had their eyes open today with this program on where they can get more help from counselors like you and your clinic. But how about a takeaway message just for giving parents that extra push when they need to help have that hard conversation about how much their kid's online and that they're concerned about them?
I'm a mom. My boys are 12 and 9, and parenting is really hard. And I do not do it alone. And even with 16 years experience in mental health, I find myself struggling every day. And if it wasn't for, a big support system, I don't know what I would do. And so if you are feeling lost, yes, find some resources, get into counseling, come and see one of us here. It doesn't have to be Sarah and I. We've got other fantastic counselors, and we're here to help. There's lots of research out there, and there's no stupid questions. And every child's different.
Mm-hmm. And we also have clinicians here that do see under 10. Just because me and Leslie prefer 10 and over, we have fantastic counselors here that will see those youngins that are under our age limit. So don't be discouraged by hearing that from me and Leslie. We have the providers here for anybody that needs help.
Wow. Do you have a website or a phone number you want to share?
Yes. So our website is www.chrysaliscounseling.com. And Chrysalis is spelled CHRYSALIS. We also have a Facebook page, and it's just Chrysalis Counseling Center, Inc. And our phone number here is 330-364-9360.
Thank you. Really a good show. Very interesting. So,
thank you.
Thanks, Leslie Corns, licensed social worker and licensed professional clinical counselor, and Sarah Garabrandt, licensed professional counselor and licensed independent clinical dependency counselor, both with Chrysalis Counseling Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Studio Arts and Glass and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters at the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here Friday on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.